Welcome to Outspoken with Dr. Regina Davis Moss, where we tell the truth about reproductive justice, about narrative power, and about the policies and the cultural forces shaping our lives. I'm Regina, and I'm really glad you're here. This month, we are centering Black maternal health. But let's be clear, this is not a conversation about medicine, about maternal mortality, and it's certainly not just about individual choice. Black maternal health is about power. It's about care. It's about who is listened to, who is believed, and who is supported, and what this country is actually willing to protect. Because too often, the conversations get reduced to crisis, to statistics, to outrage after the fact. But the conditions Black women and Black birthing people are navigating did not appear out of nowhere. They are shaped by policy, by culture, by bias, and by long standing decisions about whose lives are treated as urgent, whose suffering is normalized, and that is the frame for today's conversation. That matters a lot right now because Black Maternal Health Week is not just about awareness. It's about who needs to pay attention to what Black women, Black birthing people, care workers, and advocates have been naming, and that is building. And we have been doing that for a long time. And this moment matters in particular because Black Maternal Health Week is not just about awareness, as I said. It's a call to pay attention. It's a call to pay attention to what Black women have been saying. And at a time when so many people are fighting for dignity, safety, and the ability to make decisions about our bodies and our families, Black maternal health reminds us how deeply care, policy, and power are connected. It reminds us of something else also. And the answer is not about naming the harm, it is about protecting community based care. It is about supporting culturally grounded models of care. And it's about listening to the people doing this work closest to the ground. That is why I'm so excited for you to hear from today's guest, because narrative power shapes what people understand, what they believe, they are willing to defend, and that has real consequences. This is what makes this conversation so urgent. Now, I have to tell you, later on in this episode, we're going to hear from Blair Imani in a special Creators Corner conversation about the role storytelling plays in shaping how people understand pregnancy, postpartum, and care, and why narrative is such an important part of this fight. But first, I am so honored to be joined by two people who brings this into focus every day. Keesha Hernandez, a birth and postpartum doula, and Saleemah McNeil, founder and executive director of Oshun Family Center. Welcome, Keesha and Saleemah. Thank you both for being here.
Thanks for having us.
Thank you, Dr. Regina. Hey, Saleemah.
Welcome.
Hey.
Yes, I'm excited for you to join Outspoken in season 2. I want to start where we're talking about what Black maternal health looks like on the ground. And before we get into solutions and what needs to change, I want to start with what this actually looks like. Keesha and Saleemah, from where you sit, what are Black birthing people navigating right now that people outside of this work may not fully see or understand? Let's start with Saleemah.
Go ahead, Saleemah.
Okay. Families are navigating risk at every level. It's not just medical, but the constant calculation of whether they will be heard, believed, or cared for in real time. So it's managing the fear and advocating for yourself in systems that are dismissive, and they're really trying to experience joy in their pregnancy and birth. So it's really the full spectrum.
How
Like,
about you?
like Saleemah was saying, we're trying to protect joy and that connection for the families to really, I would say, embrace the experience. We're statistically more at risk. And so that fear, it's right there. It's alongside the journey. And we want to, I would say, inform our families that we're working with to feel confident in these spaces, because the medical bias is heavy and it's on us. So we're trying to also talk about that self-advocacy, because we want folks to know that their voices matter and they matter.
Yeah, I'm so glad you talked about that bias because we often hear this phrase bias in care without really understanding what that means in practice. Keesha, from your work as a doula, what does bias in care actually look like in real time? And on the other side of that, what does real advocacy look like in your role as a doula in truly respectful care when you're in those moments?
I would say I see the bias in medical spaces when my mamas, my
Scroll
dad,
up.
my birthing families are not able to be heard. They're being rushed when it comes to the care that they need, next steps moving forward. They're being told that they are supposed to almost sit back and just listen to the medical provider and what they need as far as their care, but not allowing them to be seen in the process and not allowing for informed decision making to happen. I'm talking about making sure each family has information like benefits, risks, alternatives of the different procedures that they're being suggested and encouraged to do. I'm talking about them not having to repeat themselves when it comes to maybe wanting to pause a certain procedure, or pause when it comes to them not fully understanding what's happening. We need the information in almost layman terms to make it very, very easy to understand. When I see medical providers getting it right, I see them pausing for families to make sure that they understand what they've just said. I've seen them relate to them on a mental, emotional, spiritual level to make them feel seen, comfortable. I've seen them lift up my clients' voices in these spaces that are normally rushed. I've seen them make jokes. We're talking about songs. We're talking about current events. Like our clients, our families, even myself. I want to have a vibe with my provider and know that I can
Right.
connect with them.
Saleemah, I'd love for you to build on that, especially from the community and the movement side of the work. What would you add to this?
I would add that it tells us that these things are bigger than birth. We're
Hmm.
seeing an impact of structural inequities across housing, healthcare, income, and safety. So birth just exposes that Black families are navigating systems that are under resourced, fragmented, and not built with them in mind. So it really is a holistic approach when trying to be solution oriented in communities and implementing care models.
Okay, I appreciate that. Because I hope that when we're talking about this, we can really move to this as being a standard and not an
Mhm.
exception.
Right.
Let's shift a little bit to community-based care and like making that possible. Saleemah, your work is grounded in community-based care for sure and advocacy. What it kind of what does that look like in terms of if we were able to make that possible for everyone to experience that Black birthing people and their families, if we had this in a traditional system?
It will make trust possible. There's a lot of harm that has been done within the hospital systems, especially here in Philadelphia. Our hospital systems are some trauma centers and some birthing places. And the places to address your trauma is more prevalent than places that you want to go and have a healthy, happy pregnancy and baby. Those things aren't synonymous. They also aren't associated with one another. If we are thinking that trauma lives in this place, that's not a safe place for me to bring my baby into the world, then they're looking for other alternatives to figure out how they can do so. So it makes trust possible, it makes continuity possible. It allows people to be supported before, during, and after birth by folks who are rooted in the community. You
Hmm.
can't sit so high up that you're not present at a community meeting. You can't implement strategies or interventions for a community that you never spoke to. So
Mhm.
traditional systems are often a single solution that they're trying to push forward, whereas though the community care is relational and it changes the outcomes. because you don't have trust without being in the community and making decisions for the community is how our oppressors have kept us at bay. So we got to shake the tape on that one.
I'm so glad you mentioned that because people too often think when they think about before, during, after birth, they think of it in clinical terms. Keesha, let's go to you. So from if we were to shift to this sort of model, what would happen? What perspectives would change if we had a culturally grounded and rooted system for throughout people's journeys, birthing journeys?
Yeah. I would see the shift creating more confidence in family homes, knowing that they can use their voice, knowing that they could bring in different providers as well, like collaborative care models. I really love in LA, Black Maternal Health Center of Excellence. They have a collaborative care approach where they're bringing in pelvic floor therapists, they're also doing a lot of different talk therapy, therapeutic models. They are making sure that each family has the connection to different resources, the mom groups, the parent groups, and lactation groups to make sure that they feel seen, and knowing that families have other options to connect with people, providers that look like them. It really shapes the way that we see ourselves in the medical space, in the hospital, the home, the birth centers. It changes us. It helps us to really also be fully present in these spaces, and also connecting the dots with other family members and community to make sure that they can go into these spaces and not feel afraid. It's going to change so much. It's going to save lives.
Yeah. And having just returned from Los Angeles, they are doing some incredible work. So I'm so glad you lifted up the care models that are happening in Los Angeles. Saleemah, I'd love for you to add to that, especially around what it means to build systems of care that are not just reactive, but designed to help people thrive. And so for people who are just hearing maybe for the first time about community-based care as a nice add-on instead of something essential, what do you want them to understand about why this matters so deeply?
This matters so deeply because you can't make things that are for us and by us without us. It means designing care upstream and investing in prevention. Mental health and economic stability, we need long-term support for that. So community-based organizations have their finger on the pulse, their ear to the community. Specifically at Oshun Family Center, we be outside. We go to where the people are. We set up tables in parks and along Kelly Drive and just talk to people about mental health, just as a way to be within community and never get too far away where we are and then designing things for the community that's not for them. So we make sure that their voices are heard. Our clients are at the forefront of solution bases that we are putting forth in the community, because it takes for us to stay grounded and rooted in joy and justice and the care that we provide for the community to make sure that it's not a response to a crisis, but it is interwoven into the DNA of the care.
And let me stay with you for a minute. Now, I just returned from your advocacy day that kicked off Black Maternal Health Week. And I have to say, the elected officials said that you are in all the sessions and you are holding them accountable. I want to just keep the lens on advocacy and organizing and movement building. What do you believe must be protected right now if we are very, serious about improving Black maternal health outcomes?
So the one thing I always tell them is that we need money. We need way more money. Our neighboring states have maternal health budgets that supersede ours by 4 to 5 times. And so the investment has to be a part of the solution. You can't just look at the community-based organizations and healthcare systems and say, okay, well, y'all got it, but we don't have any more resources to employ that innovation or to continue for a sustainable amount of time the programming that we have. So that would mean full access or access to full spectrum reproductive care, investments in community-based providers, and the ability for Black-led organizations to lead the work without being under-resourced or sidelined. These are non-negotiables if we're actually serious about outcomes. I even talked a little bit about community-based partnerships with academia and how in some aspects they're more harmful than they are helpful.
Yes.
Because if we look at the numbers, it's not equitable at all. It literally what we see is you're getting support, research, and data on the backs of Black-led organizations where we are a 1 to 5 and getting the funding coming down the pipeline.
Yeah, and they're getting a large university indirect on that too. So
A large.
Yes. Keesha, from where you sit, like what changes most need to happen in care and accountability, and how Black birthing people are supported?
The accountability tools. One of my mentors, Kimberly Seals Allers, I'm doing work with the Earth app, and they have an accountability tool within this app, allowing for data to come through, but also understanding unique stories. I think our stories need to be kept within, our Black organizations as well, and not be taken, and allowing us to lead and guide, I would say, a lot of different experiments, like working with hospitals and working with doctors and working with the health equity department to create change based off of our stories, and seeing this implemented in real time. I think, and exactly what Saleemah was saying, the grant funding is huge to continue these experiments, to continue trying new things. I think if they could let us continue with this grant funding for Black organizations, we are going to be able to make strides as we come together, and bringing the community first. The answers are always in the community, like Saleemah was
Every time.
saying.
Yeah.
That's huge.
Yeah. So unfortunately, we're going to be coming to a close, but I want to end with one question. When you think about the future, what is your clearest sense of what is possible if we chose to invest in the right things?
I can start. So we've already seen it in small pockets. When communities are resourced and trusted, the outcomes improve. We've seen families stay connected to care, providers stay in the field, and the system start to shift. The blueprint exists. We just have to scale it. So we are in very trying times, very troublesome times. But one of the things that our foremothers taught me was that where we are now is just another place in history, and we've been here before, and we make it out every time. So I
That's right.
feel empowered and uplifted to continue moving things forward, because we've seen things progress. So we know where it can go. I just feel hopeful that we can get back to those places with our efforts as a collective.
Yeah. How about you, Keesha?
Yes, what gives me hope is seeing people like Miriam, a clinic in the Bronx that's allowing for more time, leaning into this midwifery care model where we can actually talk about the whole body approach and how we seek to, I would say, release traumas and explore health and wellness together. I would say seeing those midwives get into hospitals, also having that extra support of a doula, having that pelvic floor therapist, having more programs that integrate the collaborative care approach. That's how I see help, the hope and the help for communities to build and elevate. So I see that we are doing it in small pockets, but as a nation, I see hope with the grant funding, with the law and the policy on our side in the future.
Thank you so much. That's such an important conversation. Thank you both for the work that you do, the way you continue to show up for Black birthing people, Black families in our community. Before we transition, I want to give you an opportunity to let people know where they can follow you. Keesha, let us know about your organization, your work, and your socials.
Yes, you can find me, one at doulakeesha.com. You can schedule a consultation for birth and postpartum services, or on Instagram at doulakeesha.
And Saleemah, where can we find you?
Yes, you can find us on Instagram at Oshun_family_center, or on our website at oshunfamilycenter.org. Sign up for our newsletter so you can get monthly updates on the things that we're doing. One of our biggest projects that we're working on now is opening up a fully integrated maternal wellness center that serves as an enhancement to the standard of prenatal care. And so we're in the midst of our capital campaign. And once we get our doors open, we want all of you to come through, join us, tour, and see what we got going on in Philly.
All right. And so thanks again for both of you joining us, and to all of those out there watching. Make sure you follow these incredible organizations and these incredible leaders. Now, at the beginning of this episode, I mentioned that we would be coming back with a narrative conversation and talking about how people are shaping the stories we understand about pregnancy, postpartum care, and Black maternal health. And because the stories that people hear do not only just shape public opinion, they shape what people are willing to fight for, defend, value, and certainly what we're willing to protect. So that is part of why narrative matters so deeply to this work. And I want to turn to a special creators conversation with Blair Imani, who is part of In Our Own Voices Narrative Power for Justice Creators for Change Council. This is some amazing work that I want you all to continue to keep your eye on. Follow these creators. They are going to be making it plain all of the things that are happening, and especially how they tie to reproductive justice. In this pre-recorded conversation, Blair reflects on how storytelling shapes what people understand about pregnancy and why those narratives can either deepen harm, help and open the door to greater truth, connection, and action. Let's take a look. Welcome back to Creator Corner. It's Black Maternal Health Week, and we are joined by Blair Imani. Hey.
Hello, thank you so much for having me.
I am so excited to be in conversation with you, especially around this topic. You know, you were very intentional during your pregnancy and even after about the stories you were telling. What was most important for you when creating your content?
You know, it was kind of this journey of learning for myself. I think first and foremost, you know, Smarter in Seconds, my show, is really a show and tell of I learned something and I want to share it with my community. And going through the process, you know, of pregnancy, of prenatal care, of negotiating whether to have a midwife or an OBGYN and all the providers I was looking at, one thing that I kept coming down to was the advocacy side. I've been in reproductive health advocacy for 10 years now. And so I knew what I was up against. I knew the statistics for Black women and the outcomes for Black women, but I was really appalled at just how much I had to fight and advocate for myself constantly. And it was the fact of, or, the benefit of doing all that education and learning for my show, Smarter in Seconds, that gave me like the tools to go in and advocate for myself, being pushed towards a C-section at 25 weeks, 25 weeks gestation was when I started to get pushed towards a C-section. Well, I now know that Black women are 20% more likely than white women to have a C-section. And that's even if we have the same healthcare provider in the same hospital and the same risk factors. So it started to, give me the awareness that these are red flags and that I need to be cautious with myself and with my body and with my baby. So that's where the content came from. I was really starting to do that. Some things I was very much looking forward to. I was always very excited to be very visibly pregnant and make a video talking about abortion access and care. And so that's something that I did when I was 8 months pregnant. And it was just kind of like, how can I use this experience to shine a light and to educate, which is what I do with Smarter in Seconds all the time. But it was really important for me to do that around my pregnancy.
Yeah, I can get a sense of that. You're very aware about what content you're sharing. What did you think about when you were creating that? How did you think people were going to interpret it? And what was most important for you in terms of the messages and what you wanted people to take away?
I want it to be very fact-based. So I love working with different organizations, whether it's In Our Own Voices, whether it's working with All Above All, whether it's working with Sister Song, to really make sure that I'm not just, talking about these health outcomes, but also directing people to the organizations doing the work to improve health outcomes. So, for Black Maternal Health Week, I'm working right now with Black Mamas Matter Alliance, who've been working for a decade to create solutions and to build power. And it's just been so important to me not to just give people the information, but give them the action items. Like, hey, you want to improve this? Here's where you can donate. Here's where you can go. Here's what we can do. And I mean, you can't get too caught up in what the feedback will be. I was so certain I was going to end up on some right-wing news site talking about abortion at 8 months pregnant. But I think at this point, I built a really beautiful community. And so I got tons of, positive feedback on that video. And I think it was important for people to see because the way that, discussions happen around abortion, it can feel very us versus them, either people who are pro-abortion or people who want children. And, you know, that's why reproductive justice is such an important framework, because it's not just about, you know, that conversation. It's about bringing a child into the world if you so choose, if, when, and how you choose, being able to access abortion with no qualifications, with no judgment, with no stigma, with no barriers, and bringing all that conversation together. So I think it was very healing for some people to see. It was not nearly as controversial as I thought it would be, because I think a lot of folks recognize, you know, going through the process of pregnancy for me has made me even more pro. Well, I don't even know if I could be more pro, but it just makes you think about bodily autonomy, because you feel your body going through all these experiences. And if you don't want to be pregnant, then you absolutely should not have to be. And so it made me even more staunch in my advocacy around abortion care.
Yes, I like to talk about things in terms of being pro bodily autonomy, pro health, pro thriving. Were there things that you made an intentional decision not to share?
Yeah, so I still haven't shared my baby's name. I haven't shared, you know, people don't know when her birthday is. I think people think they know when her birthday is, but I had filmed content for quite a while. So there was a time where I was posting that, you know, I was still posting pregnant, but I had the baby. So people will never know where that is unless they're in my personal life. And I don't want to share her face. And that's because I've chosen to be a public figure, but I don't want to make that decision for her. And there's so many conversations around the exploitation of children and content creation platforms. And, you know, I think especially right now, what we're seeing around all the predation that children are subjected to and all the ways that we can better protect children. But just to know that Black girls are held to such scrutiny. And so I didn't want to expose my daughter to that. And so I'm continuing to keep, you know, her privacy and her face and her name sacred and, you know, to our family. And I think that's a really important decision to make, because, you know, I was talking to my OBGYN, Dr. Rashida Ngwamba, out here in Pasadena, and she knows my job as being a content creator. But, you know, when you say that, that's a big field, right? So I was explaining to her what I do so she get a better idea. But when you know, she was and my doula as well, Keesha Hernandez, she was like, okay, so I'm going to be helping with filming during the birth, because that's what some of the support she provides. And I was like, no, I want my birth completely offline. I don't want anybody, you know, knowing or seeing about it unless they're in the room. And that was really important for me, because there's so much that you can get trapped into sharing online. Like the more you share, the more the algorithm will run with it. It can be really beneficial to share those types of things online, not just from a storytelling perspective, but also from an analytics perspective. But at a certain point, you know, I have this wisdom from my mentor, Feminista Jones, and she says, you know, when you have a personal brand, you become your job. And if you start to hate your job, you can start to hate yourself. And so I always try to create these boundaries and these barriers. And I'm so grateful that I'm in sisterhood with people like Feminista Jones, like Leslie Mack, who always remind me that, you know, not to fall into the trap of extractiveness that these platforms can entertain and entice us to do.
Yeah, I mean, we work with Feminista Jones, we work with Leslie. You're a member of our Creators for Change Council, and that is one of the core tenets of the work. This is not performative. This is not extractive. This is work that you all deeply believe in. You know, you talked about all of the things all the efforts you were making to make sure that your daughter grows up in a protected space, a core tenet of reproductive justice, the right to raise our families in safe and sustainable environments. As you are, it's one thing to know about maternal health, right? And to study it, but as you are living it, how did your lived experience in going through that, did it change or shape the way you now think about maternal health and Black maternal health in particular?
You know, I think it's become a lot less abstract. I think for folks, you know, the average person who is even remotely aware about these conversations maybe have heard about, you know, Serena Williams and the experience that she had during her pregnancy. And like you hear echoes and things there. You might know the statistics that Black women are 3 to 4 times more likely to die due to pregnancy-related causes. But unless you kind of dive into it, it kind of can feel abstract, because, oh, is it because Black women, we just have negative health outcomes? Is it ourselves? Sometimes statistics can, you know, falsely lead us on the wrong path, but it's actually because of racism. And it has nothing to do, you know, we see those statistics consistently around education and around class. So it's not like you can learn your way out of it. You can't necessarily, you know, pay your way out of it. And even though having access to things like doula care and being able to switch providers, getting a Black perinatal professional to be able to work with you, those things money can help to do. But I think like it really just brought it from the abstract into the practical, into the real. And it was really terrifying. I had such a hard time, you know, seeing perinatal providers who didn't see my full humanity, who didn't really recognize what we were up against. And then being able to go to Dr. Ngwamba, it was just such a change. I went into her office maybe like the Monday following the weekend where 2 viral videos of Black women suffering and experiencing, horrible, non-existent standards of care had gone viral. And I had made some videos talking about that. And Dr. Ngwamba addressed it with me without even mentioning it, just knew what was on my heart and was, something that I had constantly seen, and talked about the plan. Like, if I do need to go into the emergency room, if there is something emergent, what is the plan? And the fact that she just had that awareness of seeing me as a whole person is something that everyone deserves. And so I think those things became more real and less abstract. The other thing that I'm so grateful for is that because I was doing all these videos for Smarter in Seconds, I made one video where I talked about OBGYNs and midwives and, doulas and the difference between and how they can work together in concert to provide the best, birth plan for you. I had gone into a doctor, and that's when I started to get pressured about the C-section. And I knew that awareness because I had just read statistics about Black women and C-sections. And so I was able to really advocate for myself and say, this doctor's not for me. So I think that it was really complementary, doing the education, doing the research, going through the experience, and being able to bring that information forward and just be really open about it, because the fact is I was terrified. Even the day that I was due, I was so stressed. I got an induction. I was going in to get induced, and I was changing all of my paperwork for my bank to make sure that my husband was listed as a beneficiary, just in the event that I didn't come home. And I had meant to do a will, but I couldn't bring myself to do it. It was just too stressful. But it's those types of considerations, really thinking I might not come home, and making peace with that to free myself up mentally. So it was very intense, but it just really paints a full picture, I think, for people who might only be familiar with statistics to really understand, what does that look like? What does that actually mean in practice? And being able to share that with people through my platform was really a privilege and an honor to help other people feel less alone.
I really do. First of all, thank you for sharing that. And as someone who had a very similar situation, I had had the best plans for my pregnancy, and a lot of things started going in a not so good direction and ended up getting rushed into an emergency C-section. And so what I think that illuminates for us is that you can have the best care and the best plans, but also have these other realities. What do you think, for people who are online and learning about these things, what do you think that is most misunderstood about what we learn about this online versus what actually happens in care?
I think that, one, we aren't necessarily aware as a society about how baked in racism, sexism, or the combination of the two, misogynoir, is into the gynecological field. And so I'm actually making a video with the Black Mamas Matter Alliance that might be up already, talking about that, giving the history of Black maternal health, how the man who built modern gynecology did so by performing forced experimentation on Black women without sedation, and who could not refuse because they were owned by him. But those Black women still contributed to the field with their knowledge, not only with their bodies, but with their labor, and were some of the first surgical nurses in gynecology. And so being able to call on their legacy and really recognize that it was like this from the jump. And then Black women were forced to serve as wet nurses, and just all of those things. That's why we have the outcomes we have today, and really helping people to understand that, because talking about different cases of negative health outcomes for Black women, I see comments all the time in my comment section, even though I'll have explained this is due to racism, this is due to sexism, this is due to misogynoir. I think a lot of people, one, don't want to believe it, and then also can't conceptualize it. If you haven't been a Black birthing person trying to go through the health process, you might have a hard time really thinking or conceptualizing or imagining what that could look like. I had a white healthcare provider tell me that I didn't need to treat my anemia. I could just get a blood transfusion if I hemorrhaged. But I also know that Black women, that hemorrhaging is one of the top causes of death during childbirth for Black women and for all birthing people. And so that was really alarming to me. And that was the red flag of, I need to get care elsewhere. Not treating my anemia, that's crazy. And so but even when I was at, on the bed getting ready to give birth, hearing a nurse ask and question whether they needed to prepare blood bags because I have fibroids, even though that is the standard of care. But it was just kind of like this constant, like, should we give her everything she needs? And that's having a Black, OBGYN who was very adamant that, yes, we were going to prepare the blood in case there's a situation, having a Black doula, having my husband there, having my mother there. And so that's what happens. People need to understand that racism and these assumptions that Black birthing people don't deserve the full scope of care, or that we can't make decisions about our own bodies, or that we're incompetent or incapable of doing so, that's what ends up happening, is that people start having fissures and cracks in the cycle of care, and people get left behind. People don't get checked up on. Assumptions happen. Medical students are taught even today that Black people can tolerate pain more, or that we have thicker skin. So when I saw that I had a Black phlebotomist who was doing my IV, I was like, okay, she knows that's BS. She's gonna have my back. And she was so quick with the blood draws that she did. But it was just kind of like, you see all of the failure points that could happen, and you're constantly having to fight and be so alert. Like I felt like I couldn't kind of rest into my, pregnancy, because I had to be so on guard. And that's why I hired a doula, because she was able to kind of help me relax and be there to have my back, so that my family could be present with me and not feel like they had to be on guard. And so I think it's just making it real for people and putting a human story behind it, because it's so layered. And I ultimately had such an incredible birth experience, and I'm starting to want to tell that story too. But it was because I was able to utilize all of these different things. And I kind of took an extracurricular view of my pregnancy experience, because I started participating in maternal health studies to improve Black maternal health outcomes. Because I was like, well, if I'm going to go through this, I might as well make sure it benefits everybody.
Wow. I mean, that is such a great example of what it's like to not only do your work, share what it's like to connect the systems to care, but also the solutions to some of the things that we have identified as helping to address the Black maternal health crisis. So things like doula care, expanding the workforce, giving more options, the education. And so I really just appreciate you uplifting all of those things. And that is so valuable as a content creator to be able to share that with your audience and your followers. What are some other things that you are sharing right now? What are some things that you've been watching that are important?
Well, so I have two things on that. One, I wanted to go back a little bit. I have to shout out Kim Durden from Kindred Space Los Angeles.
Yeah.
That's actually who caught my anemia. And I went in for care with her, and something just told me, I'm not just going to go with OBGYN. I also want to go with a midwife. And she was asking me about how my summer was. And I was like, well, everybody talks about how hot they are when they were pregnant, but I was actually cold most of the time and a little lightheaded. And I just kind of kept talking. And she's like, that sounds like anemia. Let's do a blood test. Let's check it out. So she drew my blood. We did the blood test. And that's when I caught the anemia. She caught it. And that's when I went back to the white healthcare provider I was going to. And she said, oh, well, we don't need to treat that. I did see that in your chart. But how dare you not give me the option to get that care? So that's where it becomes more real. So yes, midwifery. I literally said, Black midwifery has already saved my life. And, just really seeing the difference. But things that I'm also sharing and wanting to talk about, I want people to see the messiness of what it looks like to be a parent. Social media can be very misleading in that it's so manicured and so polished, but it's messy, figuring out, for example, there was, the uprisings going on in Minneapolis when I was postpartum, freshly postpartum. And so many people were telling me, just log off, but I had to step into this, Audre Lorde model of self-care, where I'm not just retreating into myself, but I'm showing up for my community. So I started making PSAs, directing people to, and that's what really helped me feel better. And then as far as other things that I'm watching, I'm loving seeing what's coming out of, Black maternal health. It's becoming this, growing conversation. And I think it's so important for people to really recognize how important and vital it is. And for it not just to be the Black community doing that, but for us to see not allyship, but comradeship of people really walking in step with us and doing that work of taking that step further. Because not every provider I had when I was, giving birth was a Black provider, but it was a lot of like white providers who had informed themselves after seeing viral videos of Black women suffering and wanting to be part of, not be part of that horrible system. But I also think it's important that we have television shows like The Pit that are doing such a great job of showing various healthcare outcomes, like, seeing bias around who's administered pain medication and who's denied, seeing the fear and the reality of what it can look like for a Black person to go into birth and go into labor. And so I think it's becoming more of a conversation, and it's really important because our Black bodies and Black people are so policed and so monitored and so surveilled. And yet, what does it look like for us to thrive? And that's why reproductive justice as a framework is so essential. And I'm very excited for the Smarter in Seconds we'll be making about reproductive justice, and really just taking it beyond the slogans of my body, my choice, but looking at how we can thrive, how we can live together and do so in a sustainable, empowered manner.
I'm so excited that you talked about the TV shows. We just had our summit last week where we've talked to showrunners and filmmakers about this very thing. We learn a lot about health on TV, through radio, online. So there's a real responsibility to creatives to make sure that the information is accurate and it's responsible. And unfortunately, we are at the close of our time. So I want to bring you back to Black Maternal Health Week and what you do best, which is create. And I want you to talk to your fellow content creators. If they are thinking about creating content about maternal health, Black maternal health in particular, what is the one thing you want them to know before they hit post?
Reach out to the organizations. I think the biggest fear that we have as content creators is that we're going to, mess up, get something wrong. Sometimes we can avoid that by reaching out to the organizations and the people who are doing that work, whether it's In Our Own Voices, whether it's Sister Song, Black Bottoms Matter Alliance. There's so many organizations that are doing this work. And so we can lean on them. They will love for you to collaborate them, reach out, ask for fact sheets. And that way you can also direct your audience towards a place where they can take their learning further, where they can grow, where they can get involved, where they can change things. And that's really the influence we want to have. Like, yes, we might, move some product for different companies, but we can also move people and move policy and move change. And I think, just bring it to yourself, like bring it to your personal stories. Francesca Ramsey talks about we stories and me stories, but you can make stories that are about yourself be relatable to other people. That's what we do so well as content creators. So don't be afraid to kind of get in the weeds, to talk to these organizations, to really share your own personal stories, but connect it to a larger story. I think that's what makes people like Roxane Gay such powerful feminist luminaries, is connecting those personal stories to larger social issues and drive that message home of how we can change things for the better. And I think it's just recognizing that it doesn't have to be like this. We don't have to have these negative health outcomes. We can heal and change and improve the systems around us. And I think true influence, true creation, whether it's content creation, whether it's influencing or, birthing, is really helping people to understand that we don't have to be content with the status quo, that we can shift, we can change, and we can grow.
You're absolutely right that it doesn't have to be this way. That is what In Our Own Voice does every day with our Black reproductive justice policy agenda. We have over 125 policy recommendations that tell elected officials exactly what to do. And I also want to just do a shameless plug because you mentioned some organizations that have information. We actually just published a Black maternal health fact sheet. So I'm going to just ask you to go take a look on our website, download that. It has great information, up-to-date information about what's happening, state of play in policy. And with that, I'm going to go back to Outspoken. Thank you so much again for joining us, Blair Imani. As always, such a pleasure.
Thank you for having me.
You heard her. That was Creator for Change Council member Blair Imani. And I am so grateful that she shared her story. How powerful was that? I also want to thank our guests from earlier in the episode, Keesha Hernandez and Saleemah J. McNeil. Such a powerful and incredible conversation. Now, before we close, I want to leave you with this month's narrative power note. We have spent this conversation talking about care, what it looks like, who receives it, who is too often denied it. But underneath all of that is something just as powerful. It's something that Blair just named, and that is story. Because policy doesn't move in a vacuum, it moves through culture. And culture is shaped by the stories people hear, the stories people repeat, and the stories people come to believe are true. For too long, the dominant stories about Black maternal health have been narrow. They have been focused on crisis. They have been focused on the statistics, on harm after it has already happened. And while those truths matter, they are not the full story. What is missing are the stories about what care should be, the stories that reflect dignity, trust, and community, the stories that center Black birthing people, not just in moments of risk, but in moments of possibility. There is a gap between the stories that exist and the stories Black people are asking for. The gap has consequences. It shapes what people think is normal. It shapes what people are willing to fight for, and it shapes what systems are designed to protect and what they are allowed to ignore. So when we talk about improving Black maternal health, we're not only talking about changing outcomes, we're talking about changing what people believe is possible and what policies move. And what that means is that the work is not just to name what is broken, it is to build and tell better stories. Stories that reflect our communities. Stories that reflect community-based care as essential, not optional. Stories that show culturally grounded care as the standard, not as the exception. And stories that honor the people who have been doing the work all along. And you've heard it from a few of them today. And just as important, it means being intentional about who is telling those stories. So the question I want to leave you with today is this. What stories are you hearing? What stories are you hearing about pregnancy? What stories are you hearing about care? And what stories are you hearing about Black motherhood? And just as important, what stories are missing? Because if we want different outcomes, we have to demand different narratives. And if we have to support the people who are already working to tell them, we will just do that. That is how we begin to close the gap. That is how we shift culture. And that is how we build the power needed to protect Black lives. I'll see you next time. Stay grounded, stay present, and above all, stay outspoken.